Speaking about COVID-19 booster vaccines, including those new Omicron booster vaccines that have been approved in some countries. So if you have questions, as usual, if you're watching us on Twitter, you can use the hashtag AskWHO. If you are watching us on other platforms, we will monitor comment section and I will pass your questions to Dr. Soumya. Dr. Soumya, we've spoken to Maria last week and last couple of weeks, and Dr. Tedros have been also saying that we're still seeing too many deaths every week from COVID-19, and large majority of those deaths happen among people who are unvaccinated. So maybe to start, before we go into booster doses, as we know, not everyone even had primary doses. So how many vaccines has WHO approved so far that have been used around the world?
Thank you, Alex. And I think what you said is a very sobering reminder to us that this pandemic is not over. In fact, we highlighted that in 2021 or in 2022, up to this point of time, that is August of 2022, 1 million people have died of COVID. And so I think that people who think that Omicron is very mild and doesn't cause any disease, this is a reminder that the Omicron variant does cause disease and does cause deaths, and that's why it's so important to get vaccinated, because that's the best protection we have against this virus. So WHO has approved up till now 11 vaccines and given emergency use listing for 11 different vaccines. But of course, around the world, regulatory agencies have also provided in-country regulatory approval for more vaccines. So you will find that in different countries, a variety of vaccines are available. But I think the important point is that all those vaccines that have been approved by WHO and by regulators do work against all of the known variants of the virus.
Thank you so much. And in terms of booster doses, which vaccine needs a booster dose according to WHO recommendations?
So according to our recommendations, we actually do advise the first booster, that is the third dose, to be given to everyone over the age of 12 years who have received their primary course of vaccination. And the gap that we advise is 4 to 6 months after the second dose or after the last dose. And this is based, of course, on data that shows that there's some amount of waning of immunity at that point of time, and that a third dose really boosts the immune response, both antibodies, but more importantly, the cell-mediated immune response, our T cells, the CD4 and CD8 T cells. That's what protects against severe disease and death. And therefore, there are many studies that have shown that giving a third dose, taking the booster, does increase the protection against severe disease, particularly for Omicron, because we know that Omicron is a variant that has been able to escape the neutralizing antibodies that are present in our blood and cause infection. But if you have strong immunity, then it doesn't cause severe disease.
Please, sorry, did I interrupt you?
So third dose, everyone over the age of 12, but starting with the highest priority groups, as we've always said from the beginning, that the elderly, those with underlying illnesses or immunosuppressive conditions, pregnant women, health workers, these are the groups to be prioritized.
Thank you so much. And WHO recommends only one booster dose, because if maybe you can clarify if there is a different recommendation for different groups, because we've seen in some countries that fourth or even fifth dose have been given to some populations.
So very recently, SAGE, which is our advisory body on immunizations, they recommended a fourth dose, that is a second booster, for only some group of individuals. These are the people who are again at highest risk of getting the infection and highest risk of dying. So again, it includes health workers and pregnant women, but also includes those who are older than, say, 60, but that age cutoff could vary by country. So countries can determine at which age cutoff they want to start giving that fourth dose. Also, people who have immunosuppressed or taking drugs that really suppress the immune system, or they have HIV that's not under control with drugs. They're on anti-cancer medications, for example, and those who have severe underlying conditions, asthma, diabetes, heart disease, neurological illnesses. So this select group of people could receive a fourth dose, really to boost again the pre-existing immunity and give them that extra layer of protection. And again, this is to be given 4 to 6 months after the previous dose.
Thank you so much. We're already receiving questions from our viewers. Here